I'm audible to her?
Yes, dear, you can
Yes.
start.
Yes, you're audible.
Yeah, first of all, I would like to thank the admin panel and the sir for giving me this opportunity for being in this platform. And I am going to take for question number 1 to 6 in reading part A. So here in the whenever we see the question paper, so first we have to go and skim for the stem words in the question statement, as well as we have to, once we are skimming, we have to match that to the text. Like we usually will have a 4 text in each questions, like it may be text A, text B, text C, and text D. And when we are saying about the text, so the topic will be one topic with the different subheadings will be. So that means the text will be interrelated. So one after the other, so it is related to each paragraph. We're going to see question number 1 to 6. Sorry, it is 6. So for each question, so we have to mention it as A, B, C, or the D. So we have to, for each question, we have to mention answer it as from which text we are going to select the answer. So we have a 15 minutes for total 1 to 20 questions. So in that, we are going to see the first to 6 questions. So first question is like the age-related consideration for initial treatment of burns injury. So here we are going to skim the edging words. So here as the topic it says that management of burns. So we are going to have we have a subheadings like the classifications, the treatment, management, and the guidelines. So these are the 4 subheadings which we have got from the text. So based on that, we are going to find the answer for all the 5 questions. So age-related consideration for initial treatment of burns injury. So here the first questions mentioning about the initial treatment. So treatment means we can go directly to the which text. So like in the first text I said that it is about the classification of the burns. The second it is treatment. So we can directly go and so the second question is the risk involved in certain treatments. So here the edging word we can find as a risk factors or the risk management. So okay, so risk is the edging words or the keyword where we can find the answer. So risk, always we are going to manage the risk factors which is associated with the conditions. So the risk management it says, so the answer will be in the option C. So the text C. So third one is when to start thinking about specialist treatment options. So about specialist treatments means what are the different treatment options which are available. So this will be seen in case of the specialist treatment options. What are the specialist treatment options? So that is the guidelines which we see in the text D. That is the guidelines like analysis 6 which has to be provided. So treatment informed by patient self-assessment. So patient self-assessment is based on what the patient says. Like for example, if we take as a pain, so what is the pain score? So this pain scores and all we can see in the last section, that is in the D. And how to categorize the severity of a burn. So here it is the edging word, it is categorize. Categorize means we are going to differentiate different or the degrees of the burns that we'll see in the first text, that is text A. So that is superficial, partial thickness or the deeper thickness. So here I have highlighted the age-related consideration for initial treatment of burns injury. The initial treatment is the edging word. And in the second question, the risk is the edging word, the risk involved in the certain treatments. When to start thinking about specialist treatment options. So specialist treatment is the edging word. And in the fourth question, treatment informed by patient self-assessment. So what patient says. So informed by the patient's self-assessment is the edging word. And how to categorize the severity of burns. So categorize, it is a differentiate or the how we are going to find the degrees of the burns. Thank you so much for the opportunity.
Good evening, everyone. My name is Sanu. I'm one of the OET aspirants from EduSkills. First of all, thank you, Father and admin panel for giving this opportunity. So here I'm going to discuss question number 6 to 10. So the topic is management of burns. First, we already know that we glanced to the test and we are making 4 separate headings: scheme for main heading, subheading, things, etc. So we already highlighted word and everything in the 4 test and made a separate heading. So after that, just check the question 6. Classification of burn injury depends on the amount of dash cost. So we can make a hedging words, classification, and amount of dash. So we know the classification is under test A. And also we just highlight the topic sentence in the test A. Burn injuries are classified according to how much tissue damage is present. In the question stem is asking depends on amount of dash cost. So amount, they used synonymous language here. Instead of amount in the test, they asked how much. So the answer is tissue damage. And next one, question 7. Patients recovering from third-degree burns are likely to experience a great deal of shrinkage and dash of their skin. So hedging words, we can mark as third-degree burns and deal of shrinkage. So we know that third degree is mentioned in the test A. So just glance through that and just see where is the answer. So in test A under third degree is mentioned that healing associated with considerable contraction and scarring. So here they use synonymous language instead of shrinkage, they use contraction here in the test, and the answer is scarring. And instead of healing, they used in the question same recovering. So it's a synonymous language used here. And moreover, fanboy is also here. And question number 8, when evaluating missed death wound, you should take into account how the burns look and whether there is dash in the affected area. So we can mark hedging words, missed death burns, and burn looks, and whether there is dash, whether there is. So this is the hedging words I marked. And here they're asking missed death burn. So we know that it is under test A. We can read that the clinician should estimate the average death by the appearance and the presence of sensation. Here, the in the question stem they asked appearance. In the test, question stem is asking about look, and the test is asking, they mentioned about the appearance. So we can see that answer is sensation. So there is a sensation in the affected area. So that is the answer in question A. And 9, you should call burn injuries by taking off dash or jewelry that the patient is wearing. So we know we can mark hedging words, word that cool burn and taking off any. So we can see that this is under management. We already marked there as a subheading cooling. So remove jewelry or hot clothing. So the answer is hot clothing because his fanboy is also present. And question number 10, when cooling the wound, make sure that you don't put patient at risk of. So cooling the wound is mentioned in the management. We already just glanced through that. So the answer we can see hypothermia. So thank you for giving, once again, thank you for giving this opportunity, and thank you.
Good evening to all. I'm Sini, one of the OET aspirants from EduSkills family. Thank you, Father Salim and all admin panel for giving me this great opportunity to participate in this discussion session. Today we are going to explain about the topic management of burns, question number 11 to 15. So as you already explained the introduction, we already done skimming of the general idea and giving for text, main idea. We are given the names as text A as classification, text B as treatment, and text C is management, and text D is guidelines. And before starting, once again, I would like to welcome all the new participants in this discussion session. Let's make an interactive session. So first we'll go to question number 11. The patient may require a dash booster depending on when they were last immunized. So can anyone say this is from which text? This question is from which text? A, B, C, D. We already have
C.
given the name for 4 text. So can you please tell me?
C.
So the question is, patient may require a dash booster depending on when they were last immunized. Let's go to the text C, management of burns. So here we can see the points number 5, check immunization status and update tetanus if necessary. So here in the question, if necessary, if necessary means we can see the in question the patient may require. So here we can see they are asking about dash booster. So here in the text they are telling check immunization status and update tetanus if necessary. Means booster means it is an, as you all nurses we know that the booster is an updation of our immunization. So then depending on when they were last immunized means the immunization status. In the text they are giving check immunization status. So answer is tetanus. So next we'll go to the question number 12. You should consider leaving dash undisturbed as these may help prevent infection. So please tell me if this is from which text?
Management. From management.
Text C, the management. So the question, you should consider leaving dash undisturbed as these may help prevent infection. So the point number 7, debridement of blisters. So in that option A, some suggest leaving intact because the blister act as a barrier to infection and others debride all blisters. So in the question, we can see the prevent infection, may help prevent infection. Means here in the text, they are giving barrier to infection. As we all know, barrier means something which is to prevent. So that is synonym of this barrier. Here in the question, they are giving prevent infection. Then you should consider. Means here they are saying some suggest. Then leaving undisturbed means intact. So in the text they are giving leaving intact. So that is the intact is meaning of undisturbed. So the answer is blister. In the text we can see some suggest leaving intact because the blister acts as a barrier to infection. So our question is, you should consider leaving what? That is leaving blister undisturbed as these may help prevent infection. So we will go to the question number 13. You should apply ointments containing dash to all deeper burns. So what is the heading word in this question number 13?
Ointment.
Ointment.
Ointments. So ointment and to all deeper burns. Means they are asking for which apply ointments containing what. We have to see what is containing in this ointment and they are asking for deeper burns. Can you please tell me this one is from which A, B, C or D?
C.
This text. Yeah, management. So let's go to the option management. Point number 8, application of antibiotics in the form of ointment should always be used to prevent infection in any non-superficial burns. In the question stem, they are asking you should apply ointments. So there is in the text they are giving should always be used. So you should apply ointments. So already given ointments containing what? Containing antibiotics. Application of antibiotics in the form of ointment should always be used to prevent infection in any non-superficial burns. As we know, it's superficial means it's the top one. It is non-superficial means it's a deeper burns. In the text, they are giving non-superficial burns, and here in the question stem, it's deeper burn. So that is the synonymous language. Non-superficial and it is a deeper. That is synonym. So we have to see all the in the question and text. They will not give straight away the question and answer. They will use the synonymous language and paraphrasing. We should make a diary for synonymous language and paraphrasing. So let's go to question number 14. In the case of mixed depth burns, what factor determines the local treatment to give? So here what are the hedging words, please?
Mixed depth bonds,
Mixed depth bonds,
local treatment,
local treatment.
What factor? So they are asking about the factor. In case of mixed depth burns, what factor determines the local treatment to give? So can you tell me this is from which text?
Text
A. Text A. Mixed
Yeah,
depth
it is from the
classification.
yeah, it is from the text A. So here we can see it's already there is a subheading. You can see three mixed depth burns. So at the last part of this, resuscitation should be based on the total of the second and third degree burns, and local treatment should be based on the burn thickness at any specific site. So they are here in the question stem, they are asking about what factor determines the local treatment to give. So determines means what? Determines something to determine how. That is based on. Okay, based on what factor? The burn thickness at any specific site. So in the question, there is already they are asking about mixed depth burns. The burn is there, so no need to write the burn's thickness. The answer is thickness. So the question asks for what factor, means what decide the treatment. Local, they are asking about the local treatments. So what decide the treatment? Then the sentence uses should be based on, means that is synonym of determines. Then this is a direct match based on the burn thickness. So answer is thickness. Let's go to the question number 15. What is the maximum number of tries recommended for attaching a drip at the scene of a burn incident? So what is the hedging words from this question, please?
Maximum number of tries. Maximum number.
Yeah, yes, maximum number of tries recommend for attaching a drip. They're asking for how many times maximum number of tries for a drip, the scene of burns incident. So from which text is this?
B, text
Text
B.
B. Treatment fluid
Text B.
resuscitation.
So let's go to text B. So text B is about fluid resuscitation. It's an initial treatment. Here it's if the burn area is over 15%, 15% of the total body surface area in adults or 10% in children, intravenous fluid should be started as soon as possible on scene. Although transfer should not be delayed by more than 2 cannulation attempts. What is the answer? How many tries? More than not be delayed by more than 2 means what?
Maximum
Two only. Maximum two.
number of tries.
Yeah, maximum number of maximum attempts we can make. So that is 2. 2 is the answer. So although transfer should not be delayed by more than 2 cannulation attempts. That is the answer. So explanation, maximum number of tries means maximum attempts. Cannulation means inserting a rib.
So my name is Josina Joy.
Thank you so much, Father, for giving me this opportunity. I am going to deal with question number 16 to question number 20. So, question number 16. How much resuscitation fluid should be a child receive per kilo over 20 kg? Here the heading words are resuscitation, child receive per kilo over 20 kg. So we can see in text B, fluid resuscitation is the heading, and in that heading we can see two subheadings, adult and children. But our question is asking about child receive per kilo over 20 kg. So in here text B we can see children give 100 ml per kg for the first 10 kg. That means for the first 10 kg, we have to give 100 ml per kg. If the child is 10 kg, then we have to give 1000 ml body weight and 50 ml per kg for the next 10 kg. For the next 10 kg, we have to give 50 ml per kg. Then 20 ml kg for the next extra kg. The question is asking about over 20 kg, the synonyms of each extra kg. So if it is 21, then we have to give 20 ml. If it is 22, then we have to give 40 ml. Next question, 17. Before attaching a fluid resuscitation drip to a 9-year-old burns patient, what percentage of the body needs to be affected? Same text B, we can see in the first sentence, if the burn area is over 50% of the TBSA in adult or 10% in children, intravenous fluid should be started as soon as possible on scene. So in question 17, they're asking about what percentage of the body needs to be affected in 9-year-old burns patient. So in paragraph, they are mentioning children. They 9-year-old burns patient and children, they are synonymous. So the answer is 10%. The question is asking about what percentage. So the answer is 10%. We should not say 10%. It is 10%. Then question number 18. What additional analgesic is recommended in the first instance for a patient with a moderate level of pain? So the hedging word is patient with a moderate level of pain. So in text D, we can see adult analgesic guidelines. There are 3 columns. In second column, we can see moderate pain. So tramadol they have given. So the answer is tramadol. Question number 19. What route should be used to administer ibuprofen to children? So the hedging words are ibuprofen to children. In text D, we can see the last portion, ibuprofen 2.5 to 10 mg, 6 to 8 hourly orally. So the answer is orally. Question number 20. After how long should a patient's pain relief regime be reevaluated? This also we can see in text D. Second sentence, analgesia should be reviewed after 72 hours and adjusted according to the pain score. So the reviewed is the synonyms of reevaluated. So the answer is 72 hours. We should not write after 72 hours because in question they are asking already after. So we should not repeat the same words. So thank you, Father, for giving me this opportunity.